Joint replacement surgery is one of the most successful elective surgeries with joints lasting longer than ever before. Let's get you ready for a new knee or hip. Getting ready for surgery. Your surgical team will provide you with a list of pre-surgery exams and tests to schedule with your primary care provider to confirm that you are healthy enough for surgery and anesthesia. Your blood pressure needs to be controlled, and kidney and liver functions should be within a normal range. For patients with diabetes, glucose levels should be within normal limits. A dental checkup is also needed before your operation, unless you have only dentures. Preparing your home before surgery. Preparing your home is an important part of keeping you safe and preventing falls. Walk through your home and be sure there is enough space between tables and couches and other furniture for a walker to pass through. Remove throw rugs, secure electrical cords, and make sure lamps have light bulbs bright enough for you to clearly see where you are walking. Place essential items like clothing, glasses, remote control, and tissues within easy reach and at waist level to avoid bending. Placing a few pots, pans, and dishes on your kitchen counter will also help prevent bending. Make sure you have a friend or family member with you in your home for the first several days to help you get to the restroom or move from your bed to the couch. They should also help you with big chores such as laundry, vacuuming, or grocery shopping. It's a good idea to prepare a few meals ahead of time that you can have ready to heat in the microwave. Getting up and walking every hour will be important, but you should not be standing at the stove for long periods of time making dinner. Make sure you have seating that is both firm and comfortable. Couches and chairs with armrests will make it easier for you to stand up. If possible, it is helpful to either stay in a bedroom on the first floor of your home or to use a reclining chair or couch for sleeping, avoiding a flight of steps to an upstairs bedroom. When you are discharged from the hospital, you may need some equipment at home. Some things we will order for you, like a walker or commode. These will likely be paid for by your insurance. Other devices, such as a cane, you may have to purchase on your own. Keep in mind that canes generally have one or more prongs, and the most important thing is for the prongs to have sturdy rubber tips to prevent slipping. You may also decide that a bathtub bench may be helpful. After surgery, your physical or occupational therapist will help you decide what you need. The day before surgery. To help reduce the risk of infection, patients will be asked to perform a pre-surgical scrub using Hibiclens, a special antimicrobial soap, twice the day before and once on the morning of surgery. Your surgeon or doctor may give you Hibiclens, or it can be purchased over the counter at most pharmacies. Hibiclens should be used from the neck down. Do not use it on your face. Pay extra attention to cleansing the hip or knee that will be operated on, and avoid applying lotion or cream afterwards. Dress in clean pajamas and get into clean bed sheets. You may use deodorant on the morning of your surgery, but no lotions, sprays, or powders. Please do not shave your legs for at least 2 days before surgery, as shaving can increase your risk of infection. If you are not feeling well, running a fever, or have a productive cough the day before surgery, please notify your provider or surgeon immediately. The day of surgery. When you come to the hospital or surgery center on the day of your procedure, please dress in loose-fitting clothing with elastic waists that are easy to pull up. Depending on the weather, shorts are often best for patients having knee replacement surgery. Tennis shoes with rubber soles are important as you will be up and walking in the hallway after surgery. Shoes should have sturdy backs. Slides are not recommended. In your bag, bring a change of clothes that is comfortable and loose-fitting. The hospital will provide toothpaste, toothbrush, and soap, or you can bring these items from home. You may want to bring your cell phone, laptop, and charger, but please know there are no locking drawers in patient rooms. Be sure to leave all jewelry at home. Bring a list of the medications you are currently taking, including prescribed dosages, time of day you generally take each, and whether you were required to stop taking them before surgery. If you have sleep apnea, please bring your machine with you. If you have asthma or COPD, bring your inhaler. If you have questions about your medications or over-the-counter vitamins and what should be paused, please talk to your surgeon, primary care provider, or the pre-surgical testing nurse. Do not eat anything after midnight on the evening before your surgery. You may have sips of water during the night. We often recommend a high-carbohydrate meal and a whole Gatorade for dinner earlier that evening. Patients with diabetes are asked to add a complex starch like sweet potato to dinner and drink Gatorade Zero, low-carb Gatorade. The morning of surgery, you will be asked to drink an electrolyte drink like Gatorade, Gatorade Zero, or Pedialyte. When you arrive at the hospital or surgery center, you must have a care partner with you. They must stay at the hospital during your surgery and be available to drive you home. Upon arrival, you will be taken to the surgical registration area and then into the pre-surgical area where you will be given a hospital gown to wear. Your IV will also be started. At that time, your care partner can be with you until surgery. Your surgeon will write on or mark your operative joint, and the anesthesiologist will go over options for anesthesia. The procedure typically takes 2 to 3 hours. After surgery, your surgeon will come to the waiting room to speak with your family or care partner. Once you are awake, your family will be allowed to visit you in the recovery room before you are moved to a regular hospital room. In the recovery room, your nurse will monitor your vital signs and provide pain medicine as needed. When you arrive in your hospital room, you will be given a menu for the next meal, having something to eat and drink which can help protect your stomach from any pain medications you may be taking. You can expect that your first physical therapy session will take place several hours after your surgery. A nurse or physical therapist will help you stand, making sure your legs are stable. While in the hospital, always use your call bell so that we can help you get out of bed or out of the bedside chair. Before and after physical therapy, your pain will be monitored and medications given as needed. We encourage your care partner to be present for your physical therapy so they can learn how to help you get in and out of the car, maneuver stairs, and manage during those first few days. Please be aware that some prescribed pain medications may cause itching, constipation, nausea, or sleepiness. It may be a good idea to purchase stool softeners ahead of time to have at home. Ice packs are also helpful when it comes to controlling any swelling that may occur. Most swelling will begin to subside after 2 weeks. Returning home. It is important that you take measures to protect your healing joint once you return home. If you have had an anterior hip replacement with an incision in the front of the hip, be careful not to kick your leg backwards and avoid sitting in a figure 4 position. When putting on your shoes and socks, you should bend forward instead of lifting your leg to your lap. Try to minimize twisting your body, keeping your knees, hips, and shoulders facing the same direction. The incision from your surgery will fill with blood and nutrients to help with healing. That can result in some swelling and warmth. This is normal. While resting, elevate your legs so that it's higher than your heart. Applying an ice compression can also help. Call your doctor if the swelling or warmth is excessive. After surgery, your doctor will have placed a waterproof bandage called an Aquacell dressing on your joint. It is antimicrobial, which means it helps to prevent bacteria, wicks away moisture, and is typically good for 14 days. Because it is waterproof, you can shower with it. Do not remove the bandage. Your home health nurse or physician will remove it 12 to 14 days after your surgery. You may also have a pressure dressing for the first evening to help decrease swelling and bleeding before your Aquacell waterproof bandage is applied. It is important to get up once every hour during the day and take small walks in your house to the bathroom or the kitchen just to stretch your legs and help prevent blood clots. Sometimes patients are prescribed a blood-thinning medication. You will be given a rechargeable wrap called a sequential compression device, or SCD, that goes around your calf, gently squeezing to mimic walking. Wear your SCD anytime you will be sitting or resting for 30 minutes, including when you go to bed at night. You will also be given a breathing device called a spirometer, which helps you inflate your lungs and prevent pneumonia. It should be used 4 to 6 times every hour while you are awake. If you experience tenderness in the calf of the leg you had operated on, please avoid rubbing your calf as that could release a blood clot that may have formed in your leg. Instead, notify your doctor immediately. Most patients return home after surgery and immediately begin outpatient therapy. Some people may start with a home health nurse and therapist who comes to the house several times a week. The nurse or therapist will often remove any staples at your incision site and the wound dressing on the 12th post-operative day. From there, you may transition to an outpatient facility for continued therapy. Occasionally, we will recommend that a patient go to an inpatient rehab facility for a period of time before returning home. Our team will discuss your plan of care with you, including what your health insurance covers. After surgery, you should carry a small card in your wallet to alert first responders that you've had a joint replacement. Even with your card, you may still be asked to pass through the X-ray machine at the airport if your new joint triggers the metal detector. Please call with any questions. Thank you for choosing UM Upper Chesapeake Health for your joint replacement surgery.